Welcome, Patrice.
Thank you. Yes, I'm sorry, my camera's not working, so I'm okay with that. But thank you for telling me. So members of the Public Health and Children's Committee, thank you for this opportunity to testify on SB2. My name is Dr. Patrice Farquharson, and I live in West Haven. I have been the executive director of the West Haven Child Development Center for 40 years. The center serves 156 children from 6 weeks to 5 years. We've been in operation since 1978 and received child daycare funding, school readiness funding, a variety of additional grants, and we have a partnership with United Way of Greater New Haven to serve 16 early Head Start families, the only one to serve early Head Start families in West Haven, and the only one to serve infants and toddlers on a sliding scale in West Haven. So there's, as you know, there's a growing awareness among the general population that social determinants of health not only affect physical, but also mental health outcomes, especially in early childhood. Social determinants, particularly those that lead to toxic stress, can stunt a young child's brain development and therefore impact their long life health. At the West Haven Child Development Center, we have understood the importance of offering mental health programming to our families. The West Haven Child Development Center offers a comprehensive program recognized by the American Academy of Pediatrics as a medical home implementation model, whereby the professional resources of the teacher, the social worker, and the nurse work together to provide a support system for children. These professionals work together to provide health services, including mental health screenings for individual children, and provide information to parents about healthy practices. The Child Development Center emphasizes preventative care, which has been proven, as you know, to be less costly and more efficient than corrective care. This health collaborative is designed to fulfill our mission of providing comprehensive services to the families we serve. Our goal is to provide the continued comprehensive services to assure the optimum growth and development of the children in our program. We strongly believe in our approach to early childhood education. To continue this approach, we need to be able to compensate the teachers at the same level as the nurse and social worker. Esteemed members, we will not address nor improve mental health outcomes for children if we do not make the necessary investments in those that work tirelessly to provide healthy environments where children spend their formative years. I am here speaking to you today as an early childhood center director. However, I have been a professor of early childhood education for over 20 years. I know firsthand the difference knowledge has in creating quality environments for children. The teachers at the center are highly educated, but like me, they must work 2 or even 3 jobs to be able to financially survive doing the work they are passionate about. Many leave the field, and as a colleague had mentioned, to work at Amazon because they will be paid $19 an hour and receive benefits. Many leave for the public school because we cannot compete with a shorter workday, a shorter year, and summers off. We need to build up the systems of support that recognizes early childhood educators as the skilled professionals that they are. This year, we need a $700 million down payment on what should eventually be a $2.5 billion system that would enable parents of the 170,000 children under 5 to find high quality, affordable early care and education in the setting of their choice. In this system, we will be able to attract the best and the brightest to the industry. Additionally, we'll be able to maintain the vast knowledge, competence, and experience of the existing workforce that can create the environments for young children that will promote good mental and physical health. Thank you for your time.
Excuse me, Dr. Farquharson, your time is almost up. If you please
I'm
summarize.
all done.
Thank you.
Thank you.
Thank
that
you.
was my last sentence.
Oh, good.
Well, thank you for your testimony and for being right on time. Certainly, I think everybody on this call would agree that we do not pay our teachers adequately, and we want to attract the best and the brightest. It's one of the most highly regarded professions, yet we do not compensate them for that. I would suggest a $700 million price tag made me gulp. Perhaps there's some way for us to accomplish at least some of that with a little bit more modest number, but we certainly take your point. Are there any questions or comments? If not, thank you for taking the time to testify today. We are very concerned about